get better, and then it's going to get worse. This is a pretty extreme case of stasis dermatitis with that weeping on the skin. You can see the swelling, you can see that brownish discoloration that goes along with varicose veins, even though you don't see any of those big ropey veins on the surface there. This is another example of stasis dermatitis plus some of the scarring called Lipodermatosclerosis.
Is this something that you see that maybe is not diagnosed correctly?
Unfortunately, yes.
Right.
Because, you know, most physicians don't think of varicose veins as an important issue, because if you just put on your hose, everything will be fine. That's what they're thinking. Unfortunately, that's not the case. The other problem is that, and we'll talk about treatments in a minute, but in the past, the treatments have been very painful, a lot of downtime, a lot of scarring, a lot of nerve damage. Doctors didn't like to perform the surgery. Now we have modern treatments. People are back to work in just a couple of days. So there's a reason for physicians now to refer on when somebody actually has problems with varicose veins.
So maybe we have, I'm sure we have some viewers that have those problems with their legs, never thinking it was varicose veins. They need to come and see you and get properly diagnosed. Mm-hmm. What do you do when you know that you have it?
Well, the first thing you need to do is need to do an ultrasound. We have 2 ultrasounds in our office because we do so much vein work. An ultrasound is the way to treat. There used to be other ways to do it, but you have to have an ultrasound because the ultrasound looks under the surface of the skin to map out the veins so that you know exactly what's happening. And you can tell exactly which veins are causing the problems, where the problem originates, are there any clots on the surface, etc. And there's 2 systems of veins in the leg. There's a deep system, which is very important. If you get a clot there or a problem, you can be in deep doo-doo. And then you have the superficial system, which is the system that I treat and causes most of the problems. And that can be treated very easily. And it's important to know which system is causing the problem.
Interesting. What treatments are available now?
So what treatments are now available? In terms of conservative treatments, you have the old-fashioned compression hose. And compression hose still have a very important part in the treatment of varicose veins for many reasons, which it can't get into now. However, the problem with compression hose is that they're heavy, they're hot, people don't want to wear them in the summer, they're hard to get on, and they don't prevent the progression of disease. They do help with symptoms. They do help with pain, aching, and swelling, and I see that a lot. However, do you want to wear compression hose for the rest of your life if you have something easy to take care of them? No, you don't. There are a few medications available in Europe to help with varicose veins that can help with the so-called tone of veins. However, they're not available in this country. They're not FDA approved. So moving on to the more modern treatments in terms of, we call it definitive treatment, you have to treat the source of the backflow. Just removing the veins on the surface will not take care of the problem. If you just treat the veins on the surface, one of 3 things will happen. Either the veins will come back, or they won't go away at all, or they'll get worse, and you'll develop blood clots in the veins that come back.
That could be deadly.
It's
a moving blood clot.
In that system, it's very rare that that would happen. Okay, so how do we treat the problem under the surface? Well, the most modern treatment is called endovenous laser ablation. So what we do is we enter the vein by a tiny little prick in the skin after we numb up the skin, and we feed a laser fiber inside the vein, and we position it very carefully using the ultrasound again, and then we just inject very dilute Novocaine around the vein, and that provides you numbing, and then we fire the laser to seal the vein shut. So the vein is sealed shut from the inside out. The vein stays there. It's not removed. It's not stripped, but it can't carry the blood flow backwards. Other veins take over, and that's very important to realize. So where does the blood go? It goes to other veins, which are normal veins, which take up the slack, so to speak.
So you're kind of just closing that road.
You're closing that road.
And it's detouring.
Right, and it's detouring to normal veins, which will allow the blood to flow in the correct direction.
Healthy veins.
Yeah.
Very good. Any other types of treatment?
There are. I was just going to talk a little bit more about the laser treatment. We do it in the office. The patient is awake. I've never had to put anybody asleep for this. We do it under local anesthesia, and I've had many people who are anxious about it and said, you know, I don't think I'm going to be able to do this, and they have always been able to. And like I said, I've done over 1,000 of these. We will frequently give a tranquilizer beforehand if somebody's really nervous, but we just do it under local anesthesia. Immediately after the procedure, we wrap up your leg, put it in a compression hose like we talked about, and you're up and walking immediately. And most people can go back to work in 1 or 2 days.
Excellent.
Yeah.
No downtime like there was years ago.
Correct.
Right. Now, what are we looking at here, Doc?
This is lipodermatosclerosis. This is that scarring of the skin that we talked about. This skin is typically going to be tender, painful, and very hard when you touch it. And it's going to be surrounded by some normal skin there. And sometimes within that brownish discoloration, you'll also have soft, bulgy veins that you can actually feel or see.
Now, after you treat something like that, does the skin go back to the normal color?
The skin will usually not go back to the normal color because that brownish discoloration is due to blood cells, red blood cells, and their iron deposits in the skin. That's called hemosiderin, and unfortunately it's very difficult to get rid of that.
But the pain will go away once you get it.
The pain, the aching, the swelling should go away.
Right.
This is another example of scarring of the skin from varicose veins called lipodermatosclerosis, and you can see that there are no visible varicose veins here. None at all, but this person has very bad veins under the surface of the skin.
Excellent that you brought these pictures in.
Here's an example of an ulcer due to varicose veins. This is a typical appearance. So it's on the inner leg above the ankle. Frequently when you have an ulcer due to varicose veins, the foot itself will be normal. Unfortunately, in this person, it's not.
Oh, I see that.
Yeah. And then here's another example. You have that ulcer in the center of the shin bone, and you've got that brownish discoloration surrounding it. So this is a typical ulceration appearance as well. This is an interesting photo. This is what you actually see on the ultrasound when you're looking at an abnormal vein. So what we do is we position the ultrasound over a vein, and this is the great saphenous, which causes 60% of all varicose veins in people. And so we position the ultrasound over that vein, and this vein's pretty big. It's 10 millimeters, which is about 3 to 4 times normal. And we squeeze the vein to force blood up the leg. And what's supposed to happen is when gravity takes over and the blood starts to flow backwards, the valves should snap shut. In this case, they're not, and the blood is flowing backwards. And you can see it on that little graph down there. It's a little technical, however.
Actually, it looks like when I record commercials, that's kind of what it looks like, too.
There you go.
So it doesn't look that weird to me.
This is a typical appearance of when we're doing the endovenous laser ablation procedure on a patient. You can see that little white tube, and coming out of that white tube is the blue laser fiber, and it's inside a vein. And that you can see my hand there with the ultrasound probe, and it's just looking at where the laser fiber itself is. And interestingly, this was somebody who had the old style ligation and stripping procedure probably 20 years ago, and their veins came back. And so we're treating the veins that grew back or were not treated at the time, and the lines on the skin are the bulgy veins that we're going to be removing later.
Wow. So varicose veins, usually from the waist down.